Now, on Emeritus Newsbrief, I'm Lynn Houston. President Obama's budget means more than just what is being spent. It means big changes for defense, education, and the space program, among others. As was first reported last week, Obama is in fact proposing that 3-year non-security program discretionary freeze that will save $250 billion over the next 10 years. 120 programs will be terminated, ending subsidies for oil, gas, and coal companies, putting in place the responsibility fee on the largest banks to compensate taxpayers for the direct and indirect help that they provided. Cuts in spending for the manned space program, delaying or canceling proposed flights to the moon, and focusing instead on developing new rocket technology. Increasing funding at the Department of Education by $2.9 billion, or 6.2%, the largest part of that proposal for the Elementary and Secondary Education Act, better known as the No Child Left Behind Act, and working with Congress to change the program. Proposed changes to the No Child Left Behind law will loosen the universal standards that were set to take effect in 2014. More money for Pell Grants and assistance to school districts. Because of the recession stimulus programs and 2 wars, the country's deficit will be about 11% of the GDP in the 2011 budget. Not unlike other crisis periods in our history, but the problem is that even when the country recovers, it is likely to remain around 5% of GDP compared to the current 1.4%. Another reason why Obama wants out of Iraq and Afghanistan sooner rather than later. More on all of those issues on the Emeritus News National World page and the No Child Left Behind story on the Education page. Other issues: medical flights to the U.S. for care for the most severely injured patients from Haiti resumed on Monday after being stopped on Friday. The federal government agreeing to pay for it all, with medical care being paid hospitals at the Medicare rates. The plan is to move these patients back to Haiti when a massive and better equipped 5,000-bed facility under construction is finished. The Department of Health and Human Services announcing that the new rules have now gone into effect, requiring employer group health plans to pay mental health benefits, including addiction services, at the same rate as medical benefits. The rules were ordered by the Paul Wellstone and Pete Domenici Mental Health Parity and Addiction Equity Act of 2008. The new law requires any group health plan with mental health and standard medical and surgical coverage to treat mental health benefits equally in terms of out-of-pocket costs, benefit limits, and practices such as prior authorization and utilization review. More on the Emeritus News Insurance page. A new study just released shows abstention education in schools does help keep the pregnancy rate down among teens. The study involved elementary and middle school African American students in inner-city schools, but the study does not include older teenagers. Still, the findings were considered a big boost for those who support abstention-only education in schools. More on that story on the Emeritus News Education page. Another warning out for those rapid refund loans from income tax returns. 2 consumer organizations claim those loan programs are outrageously expensive, often target the poor, and are increasingly unnecessary because income tax refunds from electronic filings often arrive in 2 weeks anyway. More from the Emeritus News Consumer page. The latest on the biggest issues and public policy at emeritusnews.com. And live 24 hours a day, 7 days a week on the Emeritus News channel at livestream.com. That's an Emeritus News Brief. I'm Lynn Houston.